So I recently created a hand therapy app just to have something more convenient for me to use. And so I just want to go over it real quick with you. Right here is just kind of how it's going to open up. It shows a diagnostic view, you have another splint view, a treatment view, and then you have a search view. And then you have like an about view. But mainly you are probably either going to be in the splinting view or the treatment view. The diagnostic view is mainly just going to give you a list of different diagnoses on here. And I'll just click one just so you can get an idea. It's going to give you kind of a quick diagnosis, what kind of splint you would use with this diagnosis. So I think that can just help anyone that just doesn't know which kind of splint to use. It can be helpful for hand therapists, for surgeons. And then there's a splint tab. It's going to go through the most common splints that you would use for hand therapy. So right at the top here, if I click on counterforce brace, it's just going to kind of give me a little bit of intro here. It's going to show a picture of it and a link to actually purchase it. Or if you just want a little bit more information, you can kind of click on that link there. Here's another heel bow. This isn't a splint, but this is something they're going to use commonly in hand therapy. And so it just has a list of a ton of different splints here. And then for treatment, just so I can easily have a quick reference anytime I'm doing any type of treatment. And this is just the most common treatments that you're going to be seeing. So distal raised fractures, this is probably one of the most common things that most hand therapists will see. It's going to give you what kind of splint you're going to need, how long, and then it's going to have the week by week therapy sessions, just so you have a better idea of what you're going to be doing week by week, when you can discontinue the splint. Let's do another one, cubital tunnel release. Treatment week 1, active and passive range of motion, home exercise program to educate patient on nerve glides. And then it gives you a little bit of more information here, 14 days, suture removal, something like that. So this is just kind of a quick way to look at any diagnosis and have a quick reference for how to treat that and then what kind of splint to use. And for the splint section, this is mostly for maybe you get a diagnosis, you don't know what a tip protector is. So you would just click on here. It's going to give you a little bit more information, what kind of diagnosis you might use. Here it actually has a splint pattern, but most of these are just going to have a link to show you what the actual splint looks like. And the diagnosis view is also just kind of showing you what splint you should be using for these patients. So I have a patient who has a swan neck deformity. What type of splint should I be using? You're going to use a ring splint, and here's a picture of it. So the whole point of this is just to have a simple guide, something quick to look at. And the main reason I made this is because sometimes I'll see a diagnosis and it won't register in my mind right away what type of splint they should use. Or maybe there's a different option for a splint that they might use that might be more beneficial. So I can kind of weigh those options based on their actual diagnosis, because some diagnoses are going to just be different than others. And then what I can also do is I have the treatment protocol right here. I don't have to get a book and fumble through it. It's right at my fingertips. And then I can just be with the patient there and just say, hey, I'm going to give you an idea of how long it's going to take to heal, when we can progress to strengthening or the next phase of recovery, and just kind of go from there. So where can you get this? I only have it right now on the App Store. So if you have an iPhone or an iPad, you can access it this way. And if there's anything missing from this app, I would love to hear your thoughts or any information that you feel like would be really helpful. I would like in the future to have some splint patterns. I would also like to put some videos on how to make splints. As a hand therapist, I think all the information on here is going to be perfect for what I need, but your needs might be different. You might be in a rehab setting or an acute care setting. Maybe you have a doctor that just wants to know what splint they should be using for whatever diagnosis. And I think this is a great tool for them, but they might have some other needs. And I'd love to hear like their thoughts on how to make this a little bit more useful. So thanks for watching and subscribing. I will see you in the next one. Have a great day.